Hey, good morning and welcome to January 10th, 2022. And yes, we are still talking about that dadgum pandemic, but we have experts in the house to help us understand more about that. Welcome, Dr. Burris. And
Hi, how are you?
I don't see Dr. Kim. Did we lose him there?
Yeah, but he'll be right back. He just stepped out for a sec.
Great, great. I know that we normally talk about in this segment. We've moved into your personal health and really about a new parent, that kind of thing. But this Omicron, and it looks like I've spelt it wrong. It's with an N, not an M at the end. That variant, although that maybe the new variant come out, who knows? We just need to know more about that. It's like there are some countries that are dealing with it well. Some countries are not dealing with it well. It'd be interesting to find out, hey, what are we doing here locally and also around the world? So I'm going to turn it over to the expert, Dr. Krista. What do you think?
Well, the good news is we have more data now. Last time we talked about it, I think was a couple weeks ago, and I said there's some uncertainty that'll sort of sort itself out in a couple weeks, and we're actually at that point now. So we've gotten more information. We've gotten a few weeks down the road with outbreaks in other countries, and we're able to sort of extrapolate the most likely path that we're going to be going down in the United States now. It does look like, in general, the Omicron variant is not worse than Delta and probably milder than Delta for most people. However, if people get severe disease, the outcomes are similar. So it's not great news for everyone. For a lot of people, this will be a milder illness. But for people who do get severe disease, it's still a very significant challenge.
Well, I would also say that even though it's milder, pound for pound, we're going to feel the same because it is so much faster spreading. It just hits everyone, and so everyone has a lower chance, but the numbers will probably still be the same or even more because the ERs are still getting hit, with all these people because it's just moving so quickly through the community. It feels like it's the same even though it's not in severity.
And it feels to us like it's the
That's what
same.
I'm
I
saying.
mean, I think that when we're talking to lay people, they don't understand necessarily that our experience of this pandemic is quite different than theirs because we're seeing the sickest people. And again, when we first talked about coronavirus, we talked about COVID in the concept of flattening the curve. And the idea about this was that we weren't going to overwhelm the healthcare industry. Well, we actually accomplished that with the lockdown. This time around, we have vaccines on board. And so we're able to avoid lockdown and not overwhelm the healthcare industry because vaccines are keeping people out of the hospital. However, we're making very little effort to actually flatten the curve. So what's happening is that initially we had this really steep increase, and then we went into a lockdown. This was 2 years ago, and we kind of flattened our curve a bit, and it went like this, and it was long. This time around, what we're doing is this, and we'll come down not quite as fast as we went up, but the models are pretty much all showing that we're going to peak in the next 1 to 2 weeks. This is an insane number of cases per day. Like, it's close to probably 1 million cases plus a day. And if you think we have about 300 million people in the United States, that's a significant portion of the population every day catching the virus.
Now, are you talking about 1 million people in the U.S. a day or globally?
US.
Oh boy, wow.
So at the height of the Delta surge, which was our biggest surge until now, we only had about 400,000 people catching it per day. So you can see, though, even though it's milder and results in less hospitalizations just because of the sheer number of people. We are going to produce a lot of people every day who need to be hospitalized. And it's tens of thousands of people in the hospital right now, and we're looking at probably around 1,500 deaths a day over the next month or so in the United States. So although it's milder, although a lot of people have been vaccinated, it's still going to produce a huge burden on the economy, just because so many people are getting sick all at once, that it doesn't matter if the government doesn't mandate a lockdown. If all your people are out sick, there's nothing you can do. It's not like most people have 5 people they can call up just randomly and have them come into work. It just, the labor market's tight. People are all getting sick at once. So this is going to hit the economy because of that. But also it's going to overwhelm the healthcare industry. This goes along with my sort of, I hate to kind of say it out loud, but if you have mild symptoms and you've been exposed to somebody with COVID and you're not in a high risk category, try to find a home test. If you can't get a home test, unless there's a compelling reason, just assume you have COVID. And take care of yourself that way and isolate. If you can get a test, great. But don't panic and think, oh gosh, I need to find out for sure, and I'm going to go everywhere I can and go into 8 stores and actually expose a lot of people in there and contaminate and spread the illness more. So a little bit of it is, if you're low risk and you're vaccinated and you have mild symptoms, you're going to be fine. So you just need to take some good care of yourself. If you start to develop severe symptoms, but please access the healthcare system. But if we all do that during the next couple of weeks, that'll prevent those people who do have severe illness from not being able to get into the ER for 15 hours or something like that. So this is kind of where we are, state of situation.
Yeah, I mean, the local hospitals now, nurses and staff and providers are out with COVID just because the ability to this thing to be spreading so quickly. Despite everything that they've done to protect themselves, and it's a different variant. Like we said, it's not a scary variant, but it can still wreak havoc in our day-to-day life for a short period of time. And there's still people out there who can't protect themselves as well with autoimmune diseases, or they have Down syndrome and they've even still gotten vaccinated. They still are at a higher risk. And so there are just portions of our population that we want to try to help protect even more, because this one is so ubiquitous right now.
And this also goes back to our concept of an essential worker being somebody who helps to keep the lights on and the food on the table, and all those people need to be protected as well. So I recommend that if you're in a position where you're having exposure to a lot of people, really up your mask game. Try to find at least a KN95 mask, and if you can, an N95 mask, and wear them whenever you're interacting with people, because the reality is it's just so contagious that even people who've been vaccinated and boosted can still get it. It's less likely, but they still have about a 30% chance, if they're exposed, of coming down with it. So that's pretty high compared to what we've been used to. It's actually not bad for a vaccine. It's just that we got spoiled with vaccines that were around 95% effective. And now we're looking at more like a 70% effectivity rate to prevent disease, which is actually the initial target for the vaccine. So this is where we were hoping to get. We just overshot and overperformed with our initial strains that we were dealing with. So now we're back to sort of, this is still a good vaccine. It's still doing what we were hoping for. It's still preventing severe disease. It's still preventing a lot of mild disease, but not all.
I'm curious. I don't want to gloss over this because as you talk about this being a little milder than the Delta strain, are the symptoms the same? Like loss of taste, loss of smell. Are those things still present? The only reason I ask is this morning I heard somebody talking about a relative, and they kind of prompted them with those questions. I'm just curious: is it the same?
In a lot of ways, it's similar. You cannot differentiate the strain you have based on the symptoms you have. But I will say that after seeing now, I don't know, 50 to 100 people with what's likely to be Omicron, I do see a lot more sore throat, and that's a bigger part of the complaint. So initially especially with Delta, headache, fever, body ache, more diarrhea, and then that shortness of breath. With Omicron, body ache, fever, and sore throat are the most common. They are thinking that there's less loss of taste and smell. I've still seen it. I don't use that as a 100% predictor of whether or not you have COVID. A lot of people will have loss of smell and taste if they have a sinus infection, for instance. But if you've just got a fever, body ache, and can't smell anything at all, there's almost nothing else that does that besides COVID. But can Omicron do it? Yes. Is it less likely? I think so.
Yeah, I mean, we've seen it range from people having their usual allergy symptoms to feeling like they've had a bad flu. So,
Yeah.
Generally speaking, like she said, we haven't seen in our clinic the loss of taste and smell as a whole with the Omicron, but it's still, variable enough that with at least right now the positivity, it's safe to assume if you are feeling horrible or even allergies, then you should get tested because it could be the COVID virus.
And I'd like to put a point in here about children, because the kids are going back to school now and it's just running like wildfire through the schools. And children's symptoms are variable, but they tend to have fevers and cough and sore throats. Sometimes they'll complain of headaches. Sometimes they'll have some vomiting. So there's so much overlap with all the other illnesses that are running around right now that it is very difficult to tell the difference between a child with COVID and a child with the flu and a child with RSV. So in general, if you have a small child and they're having a significant illness and you're concerned about them, you probably do need to seek medical care, especially if you're concerned about their breathing at all.
Let's talk a little bit about the going back to school thing. I know I've seen that some school systems have decided to go back to virtual learning. Some have closed their schools. What's our situation here in the Coachella Valley right now? I ask you because you have kiddos in school in several different levels. So what do we see here locally?
What we see is, the best I can describe it as, we've decided to report the weather in the hurricane. Okay. We're just going right back in there.
Wow.
Well, I would say it's more like tornadoes, right? There are some places that will escape unharmed because they do the right things, and some places that escape unharmed because probability-wise they just didn't get hit. There are school systems that are getting hit really hard.
I think the great majority of the public school systems are getting hit pretty hard, and especially because they, again, it's a staffing issue, and the numbers of kids in the school and the number of kids inside. They have to eat lunch somewhere. Compliance with good masking and vaccination is pretty low in our young children. So even though kids age 5 and up are eligible for vaccines, I think our vaccination rates are under 20%. So that means that the great majority of the children have zero immunity here. Some have had COVID previously, but not as many. And I actually think what we'll probably see is some schools have to wrestle with the decision to either take a week off or go virtual, just based on the fact that they don't have enough people to run the school. But we'll see. I don't know. But again, this looks like it's going to be a short-lived thing, and in a couple of weeks we should be past the worst of it. So they may be able to soldier on and sort of fill in the gaps. So I don't know, but I do know that it's not going to be a 3-month ordeal. This is really in the next few weeks. It's going to be a challenge.
Well, I'm just curious, and I'm only asking you to speculate. Do you think there's this fatigue from this whole thing that the parents, are saying we need to get our kids back in school because there needs to be some normalcy. The kids need a break from us, vice versa. They need to get back into their environment where they're the kids. And at the same time, you have this not picking on one specific age or demographic. And what is that doing to the coverage in the school? Like you said, they could reach a point where we're saying, hey, we just don't have enough teachers and staff to run the schools, and we just have to make a decision. Where are we? And again, I'm only asking you to speculate here in the Coachella Valley.
Like I said, I think right now they're able to kind of keep moving forward. Last week was the first week of the public schools going back. And so this week going forward, we're going to see the fallout of all that interaction, all those face-to-face interactions. So I haven't heard of any schools discussing closings. I don't think that that's on the table at this point, but they may have to get creative and, each district may handle this differently, and they may go school by school or classroom by classroom on the solutions they come up with. This is a very unpredictable time, which is hard for parents, especially if you're a working parent and you're trying to figure out whether or not you're going to need some kind of childcare. And it's unpredictable and it could change tomorrow. So again, more disruption for employers. And this is not, and I really want people to understand, this is not like Big Brother coming in and messing things up. This is what pandemics do. And this is not somebody shutting something down or making you do something. It's just the reality of what happens when everybody gets sick at the same time. Mm-hmm. And this is kind of, I think, maybe helpful for people to understand why all these other mitigation factors or protocols or restrictions are put into place. It's really to prevent the negative impacts of this happening on a global scale all at once. And imagine if Omicron wasn't less severe. Imagine if we hadn't got vaccines out in the numbers we had in our older population. We would seriously be looking at millions and millions of deaths in the United States. So this is, unfortunately, learning the hard way some of the nuances of pandemics. But
yeah, I mean, so a loosely affiliated example is we have fire seasons out here and we have fire danger levels. And when it's at a critical level, they say, don't do campfires, don't do fireworks, don't do this. Because why do they want to restrict you from that? No, because you want to help the fire department and the people that are impacted from having disasters when things are all out of whack. And it's kind of like that in the medical community right now, and for businesses, that we could let it all run amok and just let it do what it does. But then the ramifications of all that is, we're going to feel that, that those people that couldn't protect themselves or just got unlucky, they did everything they fine, and they still ended up with bad outcomes, whether that's long COVID or death or whatever. And so that's what we're trying to do, is saying, hey, right now for the season, the medical, aspect of this is sucky. And can you help us out by, like there are real life examples where families, you have 4 in the family, 3 are positive and 1 student isn't.
Mhm.
Do you send that student to school because they tested negative? Those are tough questions, and I'm not going to answer them for people, but those are the things that, we're asking people to think hard about, because, the likelihood of that kid eventually getting COVID is high, and now you send them in and then they spread it to other people. Well, eventually it's going to get to someone, even if this is a milder case, where they're going to need to go to the ER, and they're going to need to go to urgent care, or they're going to need to have something. And so we're just trying to stop those things, like Dr. Burris said, for a short period, so that we can move through this together. Or we can think about it as, well, if it doesn't affect me, then what's the big deal? Those are the hard questions that, we're not going to answer for everyone. Everyone has to answer for themselves. But that's the difficulty of a pandemic, and the tough nature of this.
Well, let's kind of wrap up by, hey, given us a fire season / Omicron season, what are some of the things that we as a society and the people watching and sharing this, what could we do to keep the chances of this wildfire or even starting a fire from spreading? Is it just simply this, the spacing and the masks? Is that really what we need to keep doing? Or are there additional Swiss cheese layers we need to put in there?
Yeah, I like going back to the Swiss cheese model and saying every little bit helps, and nothing's perfect on its own. If you haven't gotten your booster and you've been vaccinated already, go get your booster. If you haven't been vaccinated at all, talk to somebody about your concerns and reconsider. Now that we're farther down and got more experience with the vaccines, reconsider whether your initial concerns are borne out or not. If you are, attending events with lots of people indoors, make sure you're wearing the best mask you possibly can. If you're high risk and a very medically vulnerable person, for the next couple of weeks, it probably would be good not to go into crowded situations. Your chance of running into COVID right now in a room full of 100 people, I would say is about 100%. It's just everywhere. So recognizing that, and if you are high risk, even if you're vaccinated, stay home for a couple weeks. Or if you do go somewhere, make sure everyone's wearing masks and maybe go outdoors, sort of back to where we were with the outdoors and spaced out. And then if you've been exposed to COVID and you have symptoms, but they're mild, even if you test negative, stay home. Even if your rapid test was negative, you still could have COVID, and it's a really good idea not to give it to other people right now. So staying home for a few days, making sure that you're in that 5-day period, and then test again at 5 days. And then if you're still negative, then you can consider leaving that quarantine period. And that's for people who have symptoms, who were exposed most likely, or were in a high risk setting, which is pretty much anyone who's been to the grocery store. If you can, get a hold of a higher quality mask, like I said, a KN95 or an N95. And then making sure that just kind of keep an eye on, how many cumulative risks you're taking. Like, you may have something that's really important to you and you want to attend, like say a wedding or a funeral. in the week prior to that, you want to make sure you're not going over to somebody's house for a big football game party, or you want to sort of manage the cumulative amount of risks that you're taking to try to preserve your ability to go to that important event.
And I would say in medicine, tests aren't always the bedrock of what we do, whether it's a CT scan or a COVID test. And so the positive or negative aspect of them shouldn't be the foundation of what you do. Like Dr. Burris said, it's really about symptoms and where have you been and what really makes sense. And just because a COVID test is negative doesn't mean that you don't have it. And I would say if you have symptoms and you have a COVID test, the likelihood of a false positive with this amount of COVID running around is probably even lower than it would be if there was no COVID running around.
So what that means is a positive result on a test is pretty reliable right now. It's probably real. A negative test right now, in the setting of somebody with the typical symptoms, especially early on, the first couple of days, if you get a negative test, I don't go by that at all. I ask people to retest with the PCR in a couple days, because early in those first few days, our tests are just not quite as good at picking it up. So if you've got typical symptoms, assume you have COVID. Assume it right now. This is going to be different most likely in a month. We probably won't assume everybody has COVID, but right now everybody has COVID. There are some exceptions, but the great majority of what's going around right now is COVID.
Last question, and this is just a follow-up from last week when you talked about, because you are talking about getting home tests, getting tested. What's the supply of home tests look like now? I know we're running kind of short last week. How does it look? Any update on that?
I think it's better, but it's still hit and miss. I think it's, there's a surge of tests coming, but I think it's going to be a month too late. Once they're ubiquitous, and actually, I think they're planning on sending you to your home. I mean, you can go to a website, and the federal government will send them to your home. But I don't think it'll get here in time to really help with this surge. But I do think you can go. I know people go out and find some. It's just they're harder to find, and it's when the test is really key. If you have symptoms 3, 4, 5 hours ago, testing, is not going to help you. It's going to come back negative. You really should think about when is the optimal time to test yourself.
I tell people, if you have mild symptoms, wait 2 days, stay home, assume you have COVID, at least wait 2 days. And then if you only have one test, your test will be most accurate at days 3 to 4. But especially if you can wait a couple days, it'll improve the testability to detect the COVID.
Well, I want to thank you both for being here today and giving us so much good information. Along the bottom is some information about Coachella Valley Primary Care, and Dr. Burris and Dr. Kim. They have a unique way of taking care of people. We're members of their program, and instead of a typical 2,000 to 4,000 caseload, and we get 8 minutes with a doctor, they have a much smaller caseload, and they can take care of us a lot better. Now, typically we'd think that would be very expensive, like a concierge type of service. You'll be surprised that if you're under 45, it's only $149 a month, and if you're older than that, it's $99. If you're younger,
and if you're younger, it's $99. If you're older than 45, it's $149.
And there's no line about your age. You got to bring an ID, but otherwise, it'll cover, and also special opportunities for you people out there who have a family. It's a great way to know that you have two people that care about you in your corner, that you can reach pretty much any time with a text or an email or a phone call. It is the way of the future when it comes to healthcare. If you're not happy with how you're being taken care of in your healthcare situation, give them a call. Their number's on the screen today at Coachella Valley Primary Care at 642-5549. little trouble with my reading today. 760-642-5549. Give them a call or just visit them on their website at CoachellaValleyDPC.com. Guys, I want to thank you so much for all you do. I really appreciate it. And I hope to see you back next week. And maybe we can talk about something besides Omicron.
I hope so.
All right. Hey, thanks for joining us, everybody. Have a great week. And, do the things that Dr. Burris and Dr. Kim talk about. Put those Swiss cheese pieces in place. And if you're not feeling right, stay home. Get a test, stay home. Let's do our part, as Dr. Kim say, of keeping the fires down during fire season. Let's get through this with some redwoods left in the forest. Everybody, have a great week, and we'll see you next week. Thank you so much, guys. Take care.